Hi, I'm Dr. Tarone Lodog, and I'm on the Pharmaca Health Advisory Board. And today I wanted to talk to you a little bit about drug nutrient depletion. Now, you've probably heard a lot already about different kinds of herbs and dietary supplements that can interact with drugs. But we often don't talk about when we take certain medications, how they can actually deplete certain nutrients in our body. Now, there's a huge number of these out there. I'm going to pick just a couple that I think are really important for you to know. There's a class of medications called proton pump inhibitors. These are things like Nexium and Prilosec, and their job is to really shut down the acid-producing pumps inside of your stomach. And they're commonly prescribed for things like heartburn or bad reflux. Now, while these drugs can be beneficial in some people who really need it, they have a number of problems associated with them. One is that we know that they can increase your risk for fracture. And that is actually a black box warning now that's been required by the FDA, that you need to know that when you take these medications, especially if you're over 50 or if you've taken them longer than 1 year, that it can increase your risk of having a bone fracture. In March of 2011, the FDA also came out with another warning about this class of drugs, that when you take them, again, longer than a year, and people who tend to take higher doses or that are over the age of 50, it can reduce your levels of magnesium. Now, magnesium is critically important for a number of things. One, to keep your heart rhythm nice and normal, to keep your blood pressure at a healthy sort of range, and also it's very important for reducing your risk for insulin resistance. It helps keep your cells more able to take up insulin. So we don't want you having low magnesium. And the FDA, their main concern was, if your magnesium gets too low because you're on these medications, it can increase your risk of having a heart arrhythmia or having a seizure if it got too low. So if you're taking these class of drugs, it's really important for you to make sure that you talk to a pharmacist, your physician, somebody, one of your healthcare providers who can really make sure that you're getting the right kinds of nutrients that you need. For me, I recommend my patients are taking magnesium when they're on proton pump inhibitors, extra magnesium, usually 300 to 400 milligrams. That is safe for basically anybody unless you have a problem with your kidneys. If you have a bad problem with your kidneys, you don't want to take too much magnesium. Everybody else, this is a very safe amount for. I also recommend extra vitamin D and calcium to protect those bones, to make sure that we're not putting you at more risk for fracture. Now, there's another class of drugs that a lot of people are on today, and it's called metformin. Metformin is a drug that we use for diabetes and also for insulin resistance, or what we call pre-diabetes. Now, metformin, many of us prescribe it because it's very, very effective for patients that have these problems. But we know that it causes B12 deficiency. We've now had a number of fairly good-sized studies, including one that was published in the British Medical Journal, showing that when you put people on this in about 4 years, you only have to treat about 9 people to harm 1. That's how much B12 deficiency can happen, about 20% reduction in your B12. Who's most at risk for that? People who are older, younger women who sometimes take metformin for polycystic ovaries. That would be an increased risk for them because you don't want to be pregnant and not have enough B12. What if you're a vegetarian or a vegan? You might already have lower levels of B12. Now we put you on this medication and we're really going to cause it to fall. So you want to make sure if you're on metformin, especially if you've taken it for longer than a year, that you talk to your practitioner about maybe having your B12 level checked. B12, the Institute of Medicine has not given us any upper limit for B12, so it's very safe for people to use like doses of 500 micrograms under the tongue. Sublingual, those work well, and for metformin that's what you want to do, because the problem we think with metformin and B12 is that it makes it hard for you to take it up in your intestines. Normally in the last part of your small intestine, that's where B12 gets absorbed, and when you're on the metformin, it prevents that from happening very effectively, so sublingual is the best way to take it. 500 micrograms is a pretty safe dose. Last but not least, I just want to remind people, because we are interested in taking care of our bones, that there's a number of medications that can increase your risk for what we call secondary osteoporosis, meaning that you're taking a drug that causes the bones to become more brittle. 1 in 5 cases of osteoporosis in the United States is caused by glucocorticoids or steroids, things like prednisone. 1 in 5. Many, many women and men, but particularly women, take these medications because they have autoimmune conditions. So I just want to remind you, if you're taking steroids for a chronic health complaint, you're on a class of medications called antipsychotics. These are medications that we use for people with bipolar disorder or schizophrenia. These also can cause a dramatic increased risk in fracture. Any of these kinds of medications, you do want to talk to your healthcare provider and ask, are you getting everything that you need to be protected? And remember, vitamin D, vitamin D, vitamin D, vitamin D, and some calcium, magnesium as well. So again, you have many people at the pharmaca stores. We encourage you to come in, talk to the pharmacist, talk to the practitioners there, and also make sure you're talking to the prescriber. Whoever's prescribing you these medications, make sure you talk to them about your concerns that you may have so that you can protect your body the best way you know how.